heart specialist. My name is Sanjay Gupta. I'm a heart specialist in York. And today I thought I would do a little video subject of heart murmurs. So, heart murmurs. A heart murmur is a sound that is created by excessive turbulence of blood as it goes through the heart. And the turbulence is heard by a doctor, and they then worry that the turbulence may be being caused because of a problem with a heart valve or a problem with the structure of the heart, such that the normal sort of flow patterns of blood in the heart are affected and cause increased turbulence. So usually when someone says you have a heart murmur, what does that mean? That means that they're worried that there may be a problem with one of your heart valves. And a lot of people, what happens is they go to their GP for something else. The GP listens to the chest and says, oh, did you know you have a heart murmur? I think I should send you to see a specialist. And the poor patient then waits for 6-8 weeks to see a specialist. And during this time, they're constantly worried and very anxious about what it means to have a heart murmur, whether it means that they're going to have a heart attack, or whether they're going to die, or whether they're going to need any horrendous operations or anything like that. So the first thing to say is that, the majority of heart murmurs that are heard by the GP are either not there in the first place and someone has misheard them, or secondly, likely to be innocent. And by innocent, I mean that they do not reflect a major problem with the heart. So you may ask, well, why do you have a heart murmur if there is no problem with the heart? And the easy way to describe this is that if you have, for example, any state where more blood is having to go through the heart, then that would cause more turbulence. Common things like this are pregnancy. So in pregnancy, there's a lot more blood, a lot more volume that's going through the heart. And of course, there'll be more turbulence, and that can often manifest as a heart murmur. Similarly, if you're anemic, then that can also do it, because the heart has to pump much harder to try and get a lot more blood going around, and that would cause more turbulence. Thyroid problems could do the same thing. And those are simple things. They don't signify a major problem with the structure of the heart. Other cases where either one of the valves is narrowed or leaky, and if that happens, then that can, of course, cause a heart murmur. Usually, heart murmurs are more significant in the elderly population, although some people may be born with a birth defect, which can also cause a heart murmur at a young age. But generally, they're more significant in the older population. Children often have heart murmurs, which are usually innocent, and and they clear up as things go on. So it's important not to be too worried if someone says you have a heart murmur, but it is equally important to get it checked out. How do you get it checked out? You get it checked out by having an echocardiogram or an ultrasound scan of the heart. And if your ultrasound is normal, then you don't need to worry about the heart murmur, because it's an innocent heart murmur. It doesn't signify anything. If, on the other hand, the ultrasound is abnormal, then the question to ask is, well, what is it? Is it a leaky valve? Is it a tightened valve? If it's a tightened valve, which valve is it? Is it your mitral valve, on the left side of the heart, or is it the tricuspid valve or the pulmonary valve on the right side of the heart? The majority of times, if the valve problem that has been picked up is not causing you symptoms, then the doctor will simply keep an eye on the heart scan, perhaps once every 6 months or once every year. just because you have a heart murmur doesn't necessarily signify that you need an operation or something doing about it, unless the structural abnormality causing the heart murmur is actually causing a problem. So what are the symptoms that could be caused by valve problems? The predominant symptoms are breathlessness, exercise intolerance, and sometimes palpitations. Okay. If you have, in some cases, particularly with the aortic valve, which acts as the gatekeeper to the heart, you can also get symptoms of chest pain or blackouts. But usually it's going to be breathlessness and exercise intolerance. And if you don't have those symptoms, then even if you do have a valve problem, then that does not necessarily need anything doing to it. All you need is for someone to keep an eye on it, just to make sure it doesn't get worse with time. And if you do need something doing to it because you are getting symptoms, then rest assured that most things can be tackled these days. Usually they require some form of heart surgery, but the heart surgery is getting more and more routine. And so the risks associated with heart and surgery are very low. The second thing to say is that a lot of the valve problems now are being tackled percutaneously, i.e. via keyhole method. So particularly aortic stenosis, which is a narrowing of the aortic valve. You can now have something called a TAVI, which is a procedure where the valve can be implanted through a keyhole. Basically, someone passes the valve, a coiled up valve, through one of the vessels in the groin, moves it up to the heart, blows the balloon up. When they pass the native valve, crushing the narrowed native valve and implanting this new valve in. Other than that, that's about it really with heart valves and heart murmurs. I don't think you need to be worried about them, but I do think it is important that you get them checked out. And most of your GP, if he thinks you have a heart murmur, just go and see the specialist after I've had an echocardiogram, i.e. could you book me for an echocardiogram so that when I go and see the heart specialist, he's got the echocardiogram result to hand. Otherwise, what tends to happen is you go and see the heart specialist, and the heart specialist will generally say, oh, let's do an echocardiogram, and then you'll be waiting another 6 to 8 weeks before you have the echocardiogram and your mind is put to rest. So that's a little tip which will help you get things done. In the old days, if you had a heart murmur, people used to say, well, if you need any dental work or any surgical work, you need antibiotics, but now that's gone. And if you have a heart murmur, you don't specifically need any antibiotic prophylaxis prior to operations. The concern previously used to be that because the valve, the abnormal valve, is causing abnormal flow patterns, then if there's a bug in the bloodstream, then that could easily get deposited because it's going to be interacting with the valve in a different way. But that's now been proved that it is unlikely that antibiotic prophylaxis really makes any difference. And that's, I suppose, about it with heart murmurs. So my main messages really are, firstly, a lot of them are innocent. So just because you have a heart murmur doesn't mean that anything bad's going to happen to you. Two, it is important to get them checked. And three, they're of relevance mainly when they're causing symptoms. So if you are getting symptoms, and you're found to have a heart murmur, then it becomes really important to get that checked out and treat it, because treating it will get rid of your symptoms. Today is the 31st of December 2014, and I wanted to wish you all a very happy new year and a healthy new year. I put some videos out last year, and the response has been amazing, and a lot of people have found them to be useful. And so my New Year's resolution is going to be to put out more videos. One final thing. a few of you have contacted me through my website and asked if they could come and see me or have virtual consultations. And I wasn't really set up for that, but I now have there is now a website and I've registered with it. So if you wanted to have a virtual consultation, then that is possible. And the website is here on www.approveddoctor.co.uk. So if you go there, you'll find information about me. And you can always book a virtual consultation should you feel that that would help. Anyway, I wish you a very happy new year, and thank you for listening.